Hi, everybody. Sorry for that bit of confusion. We're excited to talk to you today. I am Jennifer Kohler. I am the president and one of the founders of Atlas Assistance Dogs. Um, we are a nonprofit that works with people to train their own dogs, people with disabilities to train their own dogs as service dogs. May is Mental Health Awareness Month. And so we're going to be talking today about psychiatric service dogs, talking about some of the stigmas associated with that, things to understand that you might want to be able to talk to your mental health provider about, the kind of things that service dogs can do for you. We're going to address some of the common challenges that handlers of psychiatric service dogs have, this very big sense of imposter syndrome that we often go through. And we're going to talk about some of those other areas for you. I also wanted to call out that as a nonprofit, we really rely on your support and your donations. So please take a look at the chat. There'll be a link for our donation page. We really appreciate any support that you can offer. So with that, Sasha and Michelle, why don't you introduce yourselves?
Michelle, do you want to go first?
Sure, I can go first. Hi, my name is Michelle DeRosa. I am a licensed professional counselor in the state of Virginia. I specialize in complex trauma, severe anxiety, OCD, as well as chronic health, chronic illness and disabilities. I also happen to be a service dog handler. So I come from the perspective of the psychiatric side as well as personal experience. I have my own private practice, and I also partner with Atlas Assistance Dogs to help promote and educate on the psychiatric service dog side.
And I'm Sasha Phillip. I came to Atlas first as a client to train my own service dog. And then because Atlas is one of the very few organizations that actually supports owners in training their own service dogs. There are not a lot of resources out there. So I found Atlas because I wanted help in training my own service dog. So I came to Atlas as a client, and then just wanted to be part of the solution. So I became an Atlas facilitator, which is essentially someone who one-on-one helps Atlas clients when they're in the program and training their own service dogs. And then I recently joined the board about a month ago because I just love what this organization does and what it stands for. So I'm doing all the things with Atlas because I just think it's a wonderful organization.
And I wanted to let people know that we do have Molly, our director of operations and programs, watching the chat. So please, as we're going along, if you have questions, go ahead and put them in the chat. We will either answer them as we go along or make sure there's time to follow up at the end. So we definitely welcome and encourage any interaction there. So kind of to start with, one of the topics that I would initially talk about was the difference between service dogs and emotional support animals. So, because this is an area of a lot of confusion. Both bring a lot of value. They're just trained, they're trained differently. So a service dog in the United States, a service dog is defined under the American with Disabilities Act as a dog who has been specifically trained to do at least one task to mitigate an individual's disability. And that definition of disability is very personal for the individual. The person gets to decide, do they have something that significantly impacts their life day to day? Under the ADA, that is a disability. The dog does not need to be trained by an organization. They don't need to have any particular identification. They don't have to have a vest. And under the ADA, the only things that the public can ask that individual are, is that a service dog? And what tasks do they do for you? Otherwise, their information is private and their rights are protected. And with very limited cases, such as some religious institutions or businesses where it would fundamentally change their nature, a service dog is allowed to be anywhere that handler is in public. An emotional support animal is a dog who just their existence alone helps the person. Now, there's a couple of ways with emotional support animals, and that kind of particular label is at this point mostly important for housing. And so it allows, if somebody has a letter from their therapist or mental health provider that states that they have a mental health condition, and Michelle can talk a little bit more about this, then they can claim their animal as an emotional support animal, which allows them to have their animal in housing that otherwise does not allow pets. And that's really at this point, because they're no longer allowed on airlines, the primary use of an emotional support animal title. They don't have any rights in public. They don't have to have any other specialized training. It's the existence of them being a dog, and just being that warm, fuzzy companion that's helpful, which is also a nature of a service dog. You have that emotional benefit of them being a dog, but they have the additional specialized training. Michelle, anything you want to add in there from a provider perspective?
Yeah. The main difference, a question I get a lot from clients or just people who are curious, is what's the difference between a pet and an ESA? And really, I mean, if you look on paper, there's not much specific differences. I'll kind of give, examples. An ESA can be any animal, so it doesn't have to necessarily be a dog. It can be a dog, cat, lizard, all different kinds. There's not under the law, there's not a designated type of animal. And then, as Jennifer was saying, there's no training, there's no specific tasks that they have to learn or have to know. It is truly just emotional support. And why it has a designation of emotional support animal underneath the protection of the housing, the HUD, the Housing and Urban Development Department, is for designated for protection for those who are disabled of having their emotional support animal be not allowed or disallowed due to pet policies, or if they have to move, that might cause significant emotional distress. So the designation between a pet and an ESA is a specific disability mitigation tool or treatment that is provided by a doctor or a mental health provider to support a patient's or someone's mental health. So it's very open-ended, and it's supposed to be, but it is completely different category than psychological service dog or service dog. But that's really, as Jennifer was saying, the only protections that they have is housing. So no longer do they have airline protection. Airlines, as of 2020, I believe 2020, 2021, passed a final notice that states that they view ESAs as the same as a pet. So yeah, that's the difference between a pet and an ESA. They're protected, while a pet is a pet.
And just in terms of the language that we're using, I just wanted to say Atlas assistance dogs are service dogs. So a lot of times people will confuse assistance dogs for ESAs. Assistance dogs and service dogs are in the same category. Generally, when people talk about service dogs, a lot of times people assume that means, you have to be blind, or you have to be a wheelchair user, or something like that. And we'll get to the piece about psychiatric assistance dogs. But just to be clear about the language, when we talk about assistance dogs, that is the same thing as service dogs.
Thank you. And so with that, Michelle, why don't you tell us a bit about psychiatric service dogs, some common examples of what they can do and who they can help?
Yeah, absolutely. So psychiatric service dogs are service dogs. They are under the umbrella of an assistance dog or service dog. They're not regarded as a completely separate thing. We just like to designate or utilize, it is for psychiatric based disabilities. So if that's a question in your mind, if they're different, nope, they're all underneath the ADA protection, the Department of Justice protection of service animal or assistant animals, as Sasha was saying. So psychiatric service dogs are, we might have in the past used the word prescribed or indicated, provided, suggested by a provider to help people who are disabled by mental health symptoms. So whether you've been diagnosed with a mental illness or you struggle with a chronic mental struggles, mental illness, a psychiatric service dog can be indicated to help mitigate the disabling symptoms. So what does that mean? Well, common examples I'll give from my own experiences. Samson, who is memorialized here, I currently have a service dog in training, but Samson was both a psychiatric service dog to me as well as a mobility or medical assistant. They can be a blend of two, but today we're just going to be talking about the psychiatric components of it. If somebody was to have, say, panic disorder and or agoraphobia, so those that diagnosis is someone who has significant panic attacks, avoidance of going to places that might trigger panic attacks, a lot of really, really unpleasant physical sensations that are really inhibit or disable someone from being able to interact in life. Under the ADA, as Jennifer was saying, there are specific categories of things that people who are disabled by mental health struggles don't get to do as easily as people who don't have the mental health struggles. And a service dog or psychiatric service dog would be task trained to mitigate those things. And what I mean by that, as examples, would be if somebody is struggling with panic disorder and they have a panic attack, and they are disabled by it. They can't speak, they can't move, they can't breathe. It feels like a service dog can provide deep pressure grounding. Deep pressure therapy is what it's often called. And you can correct me if it's changed, the language for that. I'm pulling from old stuff here, my own experience, leading to an exit, finding a seat, finding a bench to sit down on, picking up dropped objects. Oftentimes, in my experience, my hands don't work and keys might drop, things might drop. Bending over was really difficult for me for medical reasons. So it blends in. Picking up dropped objects, leading to a trusted person. I'm not talking about find a stranger. I'm talking about a trusted individual like your partner or service human that you usually go with. Alerting to physiological changes or behavioral changes. If somebody who usually is about to have a panic attack often picks at their fingers, a dog can be trained to notice that and interrupt behavior or alert behavior so that you can get yourself to a safe space, to take medication if you need to, take deep breaths, use your coping skills that you are taught in therapy, such as like agoraphobia. There's a lot of exposure inherently built into having a service dog, which we're probably going to talk about today. But Sasha, I don't want to take up too much time. You might have some common examples, but I wanted to give an overview and then some basic examples, but we can ping pong this part of it.
Yeah, thank you. And I think you've covered a lot of the tasks that a dog can provide for various different psychiatric disabilities. Deep pressure therapy certainly being one of them. So if a dog is, for example, lying across someone's lap or across someone's chest, or even if you're in a restaurant, light pressure therapy might be another one where a dog can be task trained to put their muzzle in someone's lap, for example, just to provide
Or to
that,
lay across their feet.
or lay across their feet, exactly, to provide some light pressure therapy. Another thing, I think, Michelle, you pointed out, if someone engages in repetitive body-focused behaviors like picking at fingernails or scratching, that is something that a dog can be task trained to interrupt. So you'll train the dog to nudge at your fingers or stick their nose between your fingers to help alert the person to the fact that they're doing it at all, because sometimes that's not even something you're consciously doing, and B, just preventing it and stopping that behavior. Another one might be folks that have social anxieties, who might not be comfortable in crowded spaces and might need a dog who will help them get out of that situation when that anxiety spikes. So the dog might be trained to get up and lead towards an exit so that the person can leave gracefully. And we call that a graceful exit, so that it's not, hey, I just want to get out of this situation, or I don't like you anymore, or people are wondering, why is this person suddenly leaving the conversation? The dog can be trained to lead towards an exit, and the person can then use the dog as an excuse to leave a situation that might otherwise make them feel very anxious. So those are some of the things that a psychiatric service dog
A
might
couple
be
of
able to
others
do.
I wanted to add to that. We're also just adding space. So for some people where they, due to past experiences, really struggle with being probably like worrying about somebody coming behind the back. The dog can be trained to sit behind them, to add that space. They can be trained to circle them. They can be trained to give a warning if somebody's coming, say, within about a 6-foot radius of that person, which can make all the difference of somebody being able to do simple tasks like going to a grocery store. For a number of our clients, having that dog is the difference of never leaving the house or never going where another person might be and actually being able to be out in the world. So a lot of those space creation tasks.
I was going to mention that a lot of people, when they think of psychiatric service dogs, their mind goes to veterans or trauma, PTSD. And while that is a huge, significant, a very well-known area where psychiatric service dogs great fit, any chronic, debilitating mental illness or mental struggle, whatever you want to call it, whether we're using the diagnostic terms or not, can be a great fit for, like Jennifer was just saying, getting back to the major goal of integrating into life again. Mitigating disabling symptoms so that you can engage in treatment and you can have a greater quality of life, which I think that's one of our talking points today, is to talk about that. But any chronic mental health struggle, illness, usually can find some benefit. There are some that might be contraindicated, which if we have time today, I'm happy to kind of give some. When isn't a service dog applicable or helpful for a person or for a specific illness or what have you? But I mean, when we think about depression, we think about OCD. So I specialize in OCD. A part of treatment for OCD is exposure and creating a tolerance buildup of distress, as well as resisting compulsions and rituals. Having a service dog that helps you get into the world does expose you to triggers, does expose you that, but there's also a benefit of that into a holistic treatment plan, as well as a service dog should not become a part of that ritualized compulsion, but can provide the grounding support or the value that's necessary to be able to do the exposures. For as Jennifer was saying, is if I'm afraid of contamination but yet I need to go to the grocery store, but I often wouldn't go to the grocery store because of all the rituals and all the compulsions and all the ruminations and obsessions that really cause distress. A service dog can be very helpful to help with the grounding, help with the value based of it. Well, I have the service dog to be able to notice when I'm kind of spacing out and give me a nudge to go, oh yeah, let me stay present. Let me ground to my values. Let me use my skills that I'm going through. That for me was a huge, and is a huge part of a psychiatric service dog benefit, is not taking away, which we'll talk about today too, taking away the mental health struggle, but helping me have space to work on my coping skills, get back in life, etc. So I don't know if Sasha, you want to add anything to that, or Jennifer?
Yeah, I just wanted to say, I think sort of the larger point is service dogs are not just for folks who are obviously disabled, right?
Yeah.
It's not just someone who is visually impaired and needs some tool to navigate spaces, like physical spaces, or someone who is hearing impaired and needs a dog to alert to someone being there, or sounds, although that's certainly part of what a service dog can do. But a lot of times service dogs can be really beneficial to folks who are suffering from or struggling with things like what Michelle was describing. Maybe they're really anxious, maybe they're depressed, and that deep pressure therapy can really help. Maybe they're stressing about being in social situations and they need a dog to lead them out. But that's not something that the general public who's looking at this person would necessarily see as, oh, this person is disabled. Because I think as a society, we have a very specific idea of what disability looks like and should look like in order to warrant the assistance of a service dog. And so I think the bigger point that we're making here is that not all disabilities are visible, right? Some of them are invisible. You might not look at a person and say, oh yeah, they obviously need a service dog, and yet they could benefit from a service dog and the help of a task-trained service dog, because there are so many functions, so many tasks that a dog can be trained to perform that really help folks navigate the world better, more comfortably, more confidently. So that's really what the psychiatric service dogs can be all about.
And kind of to the point that Sasha just made, that visibility can be both a challenge and a positive for the person. For some people, some of our clients with invisible disabilities, I myself have a psychiatric service dog, so I experienced this, that I like to say it's like having a fluffy neon sign that you have something per society wrong with you. However, it also, for some people, and it can draw attention, especially depending on who your dog is, what they look like, how unique they are, or how much they remind somebody of their own pet. But they're also a way to tell the world, hey, there's something going on with me. Give me some space. Maybe understand why I might be acting differently than you expect. They are also identifying you as someone with a disability. And for someone with an invisible disability, that can actually be very helpful. To not have to have that conversation all the time, to not have to start that conversation to say, actually, this is going on with me, or I need this space, or so that actually can be very beneficial. Sasha, what you had just brought up leads really well into our next topic of talking about imposter syndrome. Maybe you can explain what a lot of people with invisible disabilities, or even without, struggle with there.
Michelle, did you want to lead into this, or do you want me to take it?
You can start it, and then I have some things to add to it, but definitely, yeah.
Yeah, so I think imposter syndrome really is a big topic. I have a psychiatric assistance dog as well. And when I first became an Atlas client, I remember having lots of conversations with Jen about, but I don't feel like I need a service dog. I don't deserve a service dog. I don't have anything so wrong with me that I should have a service dog. And so struggling with that piece of, how disabled do you need to be in order to feel deserving of a service dog? And Atlas's sort of, sorry, I'm struggling with my words here. Atlas's mission really is to serve anybody who could benefit from a service dog, not folks who, quote, need a service dog, because I think need is very subjective, right? So I certainly can benefit from a service dog, but again, to the general public, I don't look like someone who needs a dog to help me navigate everyday life and feel more comfortable in grocery stores or restaurants or social situations. And yet, having a dog with me is incredibly beneficial because they can provide that light pressure therapy, the deep pressure therapy, the interruption of repetitive behaviors that I tend to engage in when I get nervous and stressed and anxious. But it can be really challenging, especially for owner trainers that are training their own dogs with the assistance of an organization like Atlas or a private trainer. It can be really hard to wrap your head around, should I really have this dog? Do I deserve it? I'm not as disabled as that other person, right? And we try not to engage in those comparisons because it's really about what can serve you, the individual, best. To what extent can a dog benefit you and your specific disabilities and your specific needs as you define them, not as someone else or society at large defines them.
And I think an important aspect of that, kind of adding on to what Sasha said, is recognizing that a service dog doesn't just have to be about core functions like of day-to-day life. It doesn't just have to be so that you can walk or eat or drink or breathe. They can also be about having a full life. That perhaps you could walk, but you could no longer hike because of severe rheumatoid arthritis. That dog can allow you to do that. Perhaps you could handle maybe running in and out of a grocery store and getting one item. But with that dog, you could now handle going in and being in that store for 10 minutes or 15 minutes. You could go, it allows you to have a fuller life and a more meaningful life. So we really want to emphasize that a service dog isn't just a basic functional tool. They're really all about expanding and having a very full life.
Right. And on top of that, the ADA is very clear and expounds on what disability is. You're right. It's not just what we think of a very visible disability. You can't walk, blind, whatever like a visible disabling symptom is. It expounds to quality of life, the aspects of life. There's a specific like definition that includes like functionality, social, being integrated within community, things that make us human in that way. And I do want to specify and clarify that not just because you might have a diagnosis of social anxiety, depression, OCD, like a diagnosis doesn't equal disability. And the ADA is pretty clear about that. But like there absolutely is space where if you are not able to interact with life in a way that somebody who does not have those struggles, that would be an indicator of what disability might look like. So yeah, I wanted to kind of mention about that it's important to not just blanket like, oh, I am diagnosed with depression, I must be disabled. Like there's very much so like an aspect of your life that is hindered or impaired. The ADA uses words like impairment, and they list out areas of life. And it's not just walking, talking, eating, breathing, but it's also the social aspects, engaging in community, working, things like that. So while Jennifer gave a really great example, yeah, maybe you can survive not going to the grocery store. You can just order Amazon, delivery the rest of your life. But like you also don't get out and do anything else at all. Well, that's a huge part of your life that is impaired, that a psychiatric service dog can provide mitigating treatment to help you engage in the rest of your life, to engage in treatment. Maybe you don't go to the doctors, you don't go to therapy because getting from A to B is so very difficult. And so when I talk about in a little bit of how to integrate into the treatment plan, that's what is the heart and soul of psychiatric or any service dog, is helping someone be able to get the services, live life, do things that they want to be able to do.
And
Go ahead,
I'm
Sarah.
sorry, can I interrupt? Hi,
Yeah.
everyone. I'm Molly. I've been monitoring the chat. We had a question that I think might be a good time to answer now because it's kind of related. So there was a question about the definition of disability. Am I correct in understanding that if a person has a medical or psychiatric condition that is impacting their daily function significantly, they can self-identify as disabled and work on training a service dog? For instance, I know an ESA requires a letter from a mental health provider, but does someone with a disability require any sort of doctor's letter or diagnostic code to qualify for a service dog?
I can answer from Atlas as an organization, and then we'll let Michelle maybe answer just kind of more broadly. So Atlas is an organization, and this is true of most service dog organizations, and definitely any that are affiliated or trying to be affiliated with Assistance Dog International, is we ask that you have what we call a letter of medical indication from your provider, that simply states they have been working with you for some amount of time treating a particular condition. But that is not, we don't require for our purposes, and because service dogs are not covered by insurance at this point, we do not require a particular code or a particular diagnosis. This can just be a description of symptoms. But we do require that as an organization for you to be one of our clients. Michelle can definitely speak a lot more to when you do or don't need that when it relates to insurance.
I think it's really important, again, to kind of go back to what the ADA defines as disability, and that there is a legal and then a medical term for disability. So sometimes when we think of disability, we think of like SSI, Social Security, the court-based disability. You can be disabled and not ever apply or have Social Security, like the SSI disability benefits. That is a totally different process than when you are determining things like the ADA term of disability, or like when it comes to certain, we'll just keep it to service dogs. The ADA definition of disability is different than that, like Social Security disability. The ADA defines it as a person who has a physical or a mental impairment that substantially limits one or more major life activity. So that off the top of my head, that's just the ADA definition. You can go to adata.org or ADA, the ADA network. They have all these FAQs as well, but this includes, that definition also includes people who have like a record of impairment, but aren't like necessarily disabled in the present. So when I'm talking about psychiatric, I'm thinking like a chronic, like bipolar, someone who has chronic, right, that goes up and down or comes and goes. If they have a record of impairment that comes and goes, that would be considered under the ADA, which is what falls under the service dog. So when Jennifer said self-identifies, I think that's really important here to kind of like, self-identifying is also part of like a community. Like you self-identify, I am disabled, or think of like neurodiversity. If you self-identify, I'm neurodivergent, I am autistic by self-identity. But then there's also on the provider side, like there are assessments that determine impairment and that can diagnose or determine, okay, your disability, your impairment falls under these categories of OCD, post-traumatic disorder, autism, things like that. And maybe, like I mentioned earlier, say you have a diagnosis of generalized anxiety disorder. Maybe those generalized anxiety disorder symptoms don't impair or limit multiple areas of your life. That would not be a disability. It would be really challenging and difficult and a struggle, but it wouldn't be disabling. And so I want to kind of take just a very brief to talk about substantially limits and major life activities, where substantially limits is really broad. Like not every condition or diagnosis substantially limits. Like think of a allergy to pollen, a mild allergy to pollen. It limits you. Maybe you can't go out and mow, but it doesn't substantially limit like going to the grocery store, like, right? Whereas a panic disorder, you're not just like, oh, it just flares up sometimes and I just, I have a panic attack and I struggle with it. It's substantially limiting multiple major life activities would be the kind of activities you do every day, including your body's own internal processes. So breathing, eating, sleeping, thinking, doing homework, things like that. So check out ada.gov. It has specific examples of disability, but also when it comes from like a provider's level, there are, like you talked about, like a letter or being prescribed or indicated. Yes, like, and I know Jennifer and Sasha, if you have something to add into that, providers do. And I know Atlas requires, a letter of medical indication or the provider providing a letter that basically says, yes, that based on my assessment, based on the medical assessment here, medical judgment, this person falls under the ADA definition. Again, totally different than the legal definition. There's a medical definition, a legal definition. The legal definition is like SSI, and that's a completely different process. So I hope that didn't confuse more than it helped.
I think the thing I'd add to what you were talking about, Michelle, is you're mentioning chronic, recognizing that it doesn't have to be that you're facing this every second of every day. It can be that, depending on certain conditions, certain times, certain locations, that you are disabled in those contexts. So you don't have to be thinking, this gets back to that imposter syndrome of, am I bad enough? That a lot of conditions wax and wane. And the concept of a service dog giving you more, essentially, if we think about spoon theory and how many spoons we have, a service dog giving you more spoons to go about your life, that you can do more than you could do without a service dog.
Yeah. So I want to bring up the term self-determination, and what this means in terms of like not feeling disabled enough, or when if you think, wow, that like a service dog sounds like it could be for me, but am I disabled enough? Like my personal experience was, I felt like I would be taking away something from someone, because again, as Sasha was saying, like we call it invisible disabilities. Like if you look at me some days, I don't look disabled. You look at me other days and I have more of a visible disability, like a cane or a walker or something that has like a physical component, but maybe some days it doesn't look like that. So am I taking away from someone who needs it more? But need is very subjective. So when you like and I think Jennifer, you were saying like it is difficult because like when we have language of like, do you need a service dog? Well, that's really subjective. You go to, if you think, well, it would be really helpful, I could do more, I could get more out of life. I think I could. For me, I was able to go to graduate school, I was able to become a therapist, I was able to hold down jobs, I was able to do so much. I mean, if I didn't have it, maybe I wouldn't have become a therapist. Maybe I wouldn't. Maybe I would have a much smaller life, but I would be alive. Like I would be alive. Like I maybe it wouldn't detrimentally affect my health where I wouldn't be alive, but it definitely has increased independence, holistic wellness, ability. Self-determination as a definition is stating like I or you get to determine what best helps you be the person in the life you want to live. So when it comes to even like deciding to go to therapy, you might even think, or a doctor, I don't like this doctor because of their attitude or a therapist. I don't really like that modality. I want to do this. That's self-determination. When you decide I want a walker instead of a cane, that's self-determination. So it also applies here. Only you can determine really, truly, if a service dog is the right tool for you. And truly, what I had to learn and what I'm still learning is that a service dog is really only impacting my life at the end of the day, not what like other people, like a stranger said, like I wouldn't do that, or like strangers that meet you once, or even a community might say. So I think there was, and I want to make sure we have enough time for all of these, but like there was a question that we were going to maybe get to that is like, what if my provider won't write a letter? Like, what if, like, I think a service dog is right for me, but I'm hitting all these barriers, and I have some thoughts about that, but I want to make sure that I'm answering Molly's question completely and saving time for that.
I think I'll take a minute right here to remind everybody that as a nonprofit, we rely on donations from the community to be able to offer our client program at the extremely low rate we do. One thing to be aware of, especially around psychiatric service dogs, is there is very little access to them in the civilian community from foundations or other organizations. So most people that have psychiatric service dogs are owner trainers. And more than half of our clients have at least the primary diagnosis, or the primary reason they have a service dog as a psychiatric service dog. So please, if you can, we ask you to go to our website, atlasdog.org/donate, and donate today. And with that, we'll continue on providing this important information. So thank you.
Thank you, Jen. I just wanted to follow up on something that Michelle said about being out in the world and other people maybe saying, oh, I wouldn't do that, or I don't think, maybe saying, I don't think you need a service dog. And that sort of goes back to that imposter syndrome piece, right? Because a lot of times the challenge that folks run into, and Michelle, you'll probably get to this in the counterindications too, the challenge that people will face is you are more visible, as Jennifer mentioned earlier, if you're in a public space with a dog, especially if you choose to put a vest on that dog or some other indication on that dog. And again, vests are not required, but if you choose to identify your dog as a service dog, there certainly is going to be almost inevitably some public interaction where someone will challenge you on whether you actually need that dog. Well, what is wrong with you that you need that dog? You don't look like you're disabled. You don't look like you need a dog. I wouldn't have a dog. So that imposter syndrome can come up, and certainly has come up for me at various stages of training my own dog. It can come up before you ever decide to own or train a dog. It can come up as you're training the dog and you're going into public spaces and your dog isn't perfect and you think, oh my God, I shouldn't be here because my dog is not a robot and it's not doing all the things, and maybe it's pulling on the leash slightly, and oh wow, I really shouldn't be doing this, and I don't deserve a dog because I'm not doing this properly. Or it might come up even later when you have a fully trained service dog and someone challenges you on, well, why do you need this dog? Tell me more. And you're not required to divulge any of that information because it is private medical information. The only two questions that people can ask, as Jennifer pointed out earlier, is this a service dog? And what tasks is this dog trained to perform for you?
Yeah.
Um,
Yeah.
and so it can be really challenging at really any stage for a lot of folks, which again is part of the reason having the support of an organization like Atlas Assistance Dogs can be so incredibly valuable, because it's not just the training, it is also the self-advocacy when you run into situations like that in public. That confidence building, the community of being surrounded by other folks who are training their own service dogs, and folks at Atlas who are supporting you as a client, that can help work through some of those sort of internal struggles with,
Yeah.
should I be doing this at all?
Right. And Jennifer mentioned, the legal definition of like service dogs and how the Department of Justice and the ADA defines them as like anyone who has a disabling diagnosis, or what we talk a record of it, can choose, I'm gonna have a service dog, I'm gonna train my own service dog. And like, I think the question kind of asked like, what's the importance of letters, or like why? And we talked about how Atlas requires, a letter, or like the application. And like the main thing why that's important, and why having a organization like Atlas is so beneficial, is because like letters, can someone not have any like provider write this letter and go through that? Great. Yeah, sure. Like according to the ADA, like anyone who could have access or needs access to a service dog can own or train, have that. But when it comes to like housing or job accommodations, or like things that need permission, or goodness forbids, a court environment come into play, showing that you have documentation of an impairment from a doctor, from a mental health provider, showing that the dog has training, having the basis of a community. That's what is so important about that. So a letter of medical indication, we're moving past medical necessity, as I said earlier, like what does necessity mean? Medical indication, having a letter can provide that extra security and that documentation from a legal standpoint for housing, for a court related, heaven forbid something was to happen and you do find yourself in court if you have a service dog, having a paper trail, etc., things like that. And yeah, I just wanted to kind of touch on why programs like Atlas are really, really important, like Sasha was saying, to connect community, but also from like a doing it right, whatever that means. It provides a lot of security and support, and documentation.
Thank you, Michelle.
Yeah.
Looking at the time, we're kind of
Mhm.
near the end. I'd like to, one of the things that we really wanted to have a chance to do was talk about service dogs and treatment plans.
Mhm.
And so Michelle, why don't you talk about how a service dog can get worked into a treatment
Yep.
plan?
Yeah. So most people who decide like, I think a service dog could be really good for me, usually hear about it somewhere else. Like it's not very often that like a therapist or a mental health provider that like says, I think you'd really benefit from a service dog, unless they like know intimately about service dogs. And unfortunately, there's just not a lot of providers that are taught about it, understand it. So most of the time you hear about it, you go to your provider and you say, I think this would really work for me. And then, there's all sorts of options from there of determining like how comfortable that provider is, et cetera, et cetera. But integrating a service dog into your treatment plan, I'll start first with maybe you're in the beginning processes of like with Atlas, or your dog is currently not a service dog and you're wanting a service dog. As a therapist who has a service dog, I kind of have like a uniquely holistic approach, whereas maybe Not all therapists might have this insight or knowledge of how to integrate it. So, first off, I want to say, like, I encourage, if you are someone who has a service dog or interested in a service dog, and you're wanting that support to integrate a service dog into your treatment plan, and you're not sure, or you don't have a therapist yet and you're not sure of like who to reach out to, I really encourage you to find a therapist or a mental health provider who does specialize in chronic health or disability, is disabled themselves. A lot of providers, a lot of therapists who are disabled like myself will either like ally with the community, or you can see that on different like websites or profiles, or they're a part or an ally of the disabled community, or the rare service dog handler therapists out there. It's a rarity, but there are some of us, so that you can like have a provider that kind of has a deeper understanding, if possible. But if you're not able to find that, or you have a great therapist that has understanding and can implement what it would look like, is very open-ended. And what I mean by that is, let's start with the first one, is in therapy or in treatment, you have goals. Everyone has a reason or why they go to therapy, they go to a mental health provider. All the tasks, all the tasks that a service dog is trained in or being trained in, ultimately are probably tied in with your goals, why you're in therapy. So I'll give just a basic example. If I'm in therapy for trauma processing, then my psychological service dog might be task trained to interrupt dissociative, or help ground, like let's say interrupt dissociative behaviors, or skin picking or something like that, or grounding. So if I'm in a dissociative episode, they come on over and give you that grounding where you can kind of come back into your body, use your skills. That's a great way to integrate it into treatment. So what that might look like is having a discussion with your provider of how your service dog can show up in therapy, in session, and have space for that tasking to happen. It might look like processing or discussing with the provider what tasks could be really helpful, or what is really helpful when you're struggling with these things. So going back to trauma, if you've discussed with your provider that there are some grounding or relaxation techniques that work really well as you're processing some of these things, how do you integrate that within your dog, your service dog? So it might look like specifically creating a relaxation plan with the dog. So feeling the dog's fur, taking breaths, like noticing different things using your eyes, your senses, like specifically in relaxation. But going back to your goals, is your goal to get out more, get out of the house more, go to grocery shopping, be able to have more independence? How can that be integrated and kind of kept, I don't want to necessarily use the word accountable, but kept like transparent with your provider? If your provider can be asking how many, if you're in the training aspects with Atlas, processing those things. Sasha, I don't know, and Jennifer, if you have any comments about how maybe you have talked about service dog life with your providers.
I think Freya's actually been more helping our clients come up with ways to talk to their providers, or in some cases joining them talking with their providers, who may think, well, I've seen some providers who really don't understand service dogs say that people are using the service dog as an avoidance of treatment, or they're using them as a crutch, and helping the provider recognize, no, it's just like how medication could help, or doing the therapy can help, that they're part of the process. They're not an avoidance, they're part of a solution. And so helping the provider understand that if they don't, because I have seen cases where providers will push back on clients and discourage a service dog. And so if you are hitting that situation, that would be the time to look for a different provider, or look for possible education for your provider if they're open to that.
Right. Yeah.
Yeah, I would definitely echo that. I think, as Michelle pointed out, there aren't a lot of providers out there who are service dog handlers themselves. So there might be some education required, or at least dialogue required with that provider around being collaborative. If you really like your provider, being collaborative around figuring out what the treatment goals are and how the dog might fit into those treatment goals and what kinds of tasks the dog might be able to perform, because the provider might also have suggestions on, hey, this is what we're doing for you, and these are some of the things a dog could maybe do once they know more about what dogs can do, because again, not all providers know what a service dog tasks, what service dog tasks might look like. But having that collaborative conversation with a provider around, here's what they can do and here's how some of that might help further my treatment goals, I think can be really valuable. Again, if the individual has the spoons, the mental capacity to have that conversation, because sometimes that may not really be an option, and the better option might be to find a provider who is more well-versed in using dogs in therapy or as part of the plan.
Yeah, unfortunately, it is a reality that, you know, some providers may not feel comfortable or want to, but providers have ethics requirements that to not practice outside of their scope. So many don't feel comfortable simply because they don't feel like they've gotten a lot of training into it, or they don't really understand the liabilities or lack of liabilities or things like that, and maybe don't feel comfortable meeting someone once or twice, and then writing a letter or incorporating. So with no real history information. So I tend to encourage, like, I highly recommend, if you were just starting your journey with a provider, that you plan to see them if financially able to at least see them for 4 to 6 sessions, or talk with them about that first, so that you can get a good diagnostic treatment plan going, diagnosis, treatment plan, assessments, if that's something that you are interested in doing, before kind of discussing or integrating a service dog. And this is so you can build a relationship with that provider and begin working towards your goals together. So like Sasha was saying, it can be integrated into. They can form some diagnostic assessments that can help inform whether they recommend a service dog for you. However, there are instances where, like you said, that they don't recommend a service dog, not because of like a contraindication, which we may not have time to get to today, but they're just not comfortable. If the provider isn't willing to be curious, listen, learn, then it would be time to seek out other options if you feel, again, that a service dog is something that is right for you.
Why don't we very briefly, Michelle, why don't you say very, very briefly about what a couple contraindications are, and then Molly, let's go to some of the questions.
Yeah. So, yes, what would contraindicate a psychological service dog? From a mental health standpoint, someone who is not mentally resilient enough to handle the difficulties associated with a service dog is number one in my mind. And I'm not saying that as like, oh, you're not. I'm not saying that in a harsh way. Like, we're all on a journey, and when it comes to disability, like, it's a spectrum between like not disabled, not distressed, not being impacted, to profoundly disabled. And so a service dog actually is a disability tool that is best like utilized when you can actually engage with the world around you and the dog. But if you can't engage with the world around you and the dog, you can't listen to cues that the dog is giving you, can't use your skills, then the trainers can tell you there's going to be something called an extinction of some of the behaviors, but you're also not going to be able to benefit of the tasks that are supposed to mitigate your disability. So dog training and handling is very, very hard and overwhelming. If a person is unable to tolerate the distress in a safe way, that for the dog, themselves, and others around them, a service dog may not be right for them at that time. So for example, if you're getting a service dog for agoraphobia, which agoraphobia is largely, I won't go into a major definition, but agoraphobia might show up like, I don't leave a safe space, a house, for days, weeks, months, years on end. to have a service dog and training with Atlas, like you would be required to leave the house, safe zones in order to attend trainings. You also have to take your dog outside to go to the bathroom. You might have to leave a room or a couch or wherever your safe zone is to interact with that. This is a part of the therapeutic benefit of a psychological service dog, and that a part of a treatment for agoraphobia or for these things, it would be gradual exposure. If you are not able, or you're not at a place at that time where you're able to tolerate the distress, a service dog might not be right for you at that time. Another would be if someone is planning to utilize a service dog for non-therapeutic purposes. So someone wanting to utilize a service dog as a protection, working dog in tandem, due to their mental health disabilities to feel safer. They're wanting to use it as a protection. Jennifer and Sasha can talk a little bit more about that. That would contraindicate a psychological service dog, because it goes over into what a service dog isn't, which is not a protection dog, cannot be aggressive, cannot do tasks that are intimidating or aggressive. Or if someone, I'll give an example of OCD, if someone with OCD, part of their disability is, engaging in these rituals and compulsions, but someone with OCD planning on including a service dog in various rituals with no desire to apply disability mitigating or treatment planning, like they're just like not wanting to do those goals. Like, I'm getting a service dog to aid a particular ritual or compulsion. Or this might sound kind of out there, but the nature of OCD is to kind of figure out something and ruminate. I'm getting a service dog to prove to my OCD that I'm not attracted to animals, or whatever it is. That would contraindicate. They're kind of taking it, and essentially it can make it worse. I think Sasha gave an example of like social anxiety. Man, boy, does having a service dog put a lot of eyes on you. If you're not at the place where you can tolerate that, work through that, begin to integrate that into treatment, that's going to be really, really difficult. That might contraindicate. So those are some kind of basic areas where, as a provider, I'm going to, discuss that. I'll just give.
And I'm going to actually cut you off here.
Sorry. Yeah. Thank you.
Just because I know we're getting close on
Mhm.
time, and I know there's some questions. These are something we can talk about these for hours.
True.
Molly, go for it.
Yeah, I wanted to hear more.
I know.
So yeah, we had a few questions come up. So would someone at Atlas be willing to have that conversation with a provider? So if a provider is not willing to talk about service dogs, or someone at Atlas be willing?
So yes, that's something that we can provide resources to your provider. Michelle has offered before that if you need information from a provider directly, if someone has that experience, she's willing to talk to your provider. So yes, if that's something you need help with, please contact us at info, and we can help you with a framework for that.
Then there was just a question about, is this going to be recorded? And yes, it is recorded, and so we'll post this later for those who came in a little late. Yeah, all the questions. This is probably a bigger question that we may not have time to address right now, so we might have to talk about this a different time. But we had a question about if we could address complex PTSD. So that's kind of a whole big topic on its own. But I don't know, Michelle, if you want to maybe give a brief overview of what complex PTSD is.
Yeah, I'll give a very tiny, well, first off, complex PTSD currently isn't a diagnostic, there's no diagnostic criteria for complex PTSD yet. Hopefully in the new DSM it will be, but complex PTSD is classified of like repeated trauma throughout someone's life, whether it be like complex or repeated developmental trauma growing up, or it could be repeated relational trauma, repeated trauma. So if you think of like medical trauma, if you are somebody who is in and out of the hospital all the time, that can create what's called complex PTSD, which usually shows up more in dissociative aspects. It's much more, as the term says, complex to treat. So I'm happy to answer, like, I'm not sure if there's like a
It
specific
wasn't
question
a
about.
specific
Mhm.
question. It was more about,
Yeah.
can we just generally address it?
Yeah. Yeah. So I'm hoping that complex trauma will get more awareness in terms of diagnostic, because complex trauma is what I specialize in, what a lot of providers specialize in, because PTSD just kind of, there's a lot more depth to it.
And I had seen a question in the chat earlier. I'm not seeing it now for some reason, but it was around, are there any weight requirements for emotional support animals when it comes to housing?
Oh,
I'm not sure.
that
I'm
would
not
be
entirely
dependent on
sure.
specific
Yeah.
apartments, housing. That would be completely specific on them. But the thing about ESAs is, no, they don't have it. There's no breed restriction, species restriction, weight restriction. They have to be reasonable accommodation. So if you have like a horse or a mini horse that you're trying to get into your third floor apartment, that might not be a reasonable accommodation. So, but it supersedes. So if you have a 30-pound weight limit in your apartment and you have like a 50-pound like bully breed as your ESA, like that would trump, because it's a part of legislation. But again, reasonable accommodation is a whole thing.
That's a whole other area.
And then this isn't a question, but just a good recommendation. Remember, if you're considering an ESA or service dog, to have a conversation with your landlord about reasonable accommodation prior to just bringing home a dog. Really good suggestion.
Good
Mhm.
reminder.
It's a great reminder.
Yeah, it's always nice to, have a good relationship with people that you're seeking accommodation from. Yeah.
Well, I know we're pretty much out of time here. Really want to thank everybody. I know this is a topic that all of us here could talk about for much longer. If there are follow-on topics, feel free to email us at info@atlasdog.org. We could consider additional talks like this or blog postings. And thank you in advance for any financial support that you offer. As Michelle and Sasha have described, and I've described, training a service dog and being a service dog handler takes a lot of support. And we do everything we can to provide that community and support to people with disabilities who may not otherwise have that support network. So hopefully this has been informative, and thank you everybody for attending.